Also going to be talking about health. More than 380,000 cancer patients have not been treated on time since 2015. That's according to data analysed by the charity Cancer Research UK. Basically, if you don't get treated on time, if you've got cancer, you've got a much higher chance of dying. It really is that simple. This is Talk. Welcome to the home of common sense. Welcome once again to Philip Ingram. Just bring out some other breaking news actually regarding the NHS. And it'd be interesting because I know you talked before about having cancer treatment yourself, but actually thankfully worked very well and had it timely. And again, it's a real postcode lottery in terms of that, isn't it? But latest NHS stats out this morning showing that the waiting list for routine hospital treatment in England has risen for the first time in 7 months. It's estimated that 7.57 million treatments were waiting to be carried out at the end of April. That involves 6.3 million patients, because some people have got more than one appointment, but that's slightly up from 7.54 million treatments. But again, that's hundreds of thousands of people. I mean, that's a lot of people who are waiting for their treatment, and it depends what you're waiting for. Are you waiting for 6 months because you need to have an appointment in 6 months' time to see something, or is it an urgent cancer referral and you're waiting for it? And we know that the more than half of people needing an urgent cancer referral are missing that. I think it's 2-week deadline. Yeah. So 2 months.
2 months deadline.
2 months, by the way, way too long.
Far too long.
Urgent should be 2 days, in my view. 2 days. We have even the Tory pledge on this. They want to hit the 18-week waiting target within 5 years to get the NHS back on its feet. We seem to have very, very low expectations and low ambition for our healthcare service now, despite it being, quote, our NHS.
Yeah, we do, and a lot of these figures are very misleading. It could be a simple blood test. It could be a routine GP appointment. It could be, because I had 3 outstanding letters from local healthcare trusts calling me in for different tests, but they'd all already been done. And these other letters came through. So a lot of this is
now that's the third world admin system we have.
Exactly.
Bureaucracy in the NHS is one of the key problems that we have, and it's holding back patients and doctors and nurses
and this is why all of the parties coming out with their health plans, I don't know how they're going to achieve them. Keir Starmer's pledge to get the waiting lists down within his first term. Yeah. It takes 6+ years to train a junior doctor. It takes 3 years to train a nurse, 5 years to train a midwife. That's more than the first term. How is he going to do that? Yeah. Make the current workforce work harder?
That's why the ambition is so low. Well, again, they have said they will pay people to work overtime.
The junior doctors want 35% for what they're doing now.
And I do find it fascinating. Wes Streeter, the Shadow Health Secretary, is very clear. We'll get this whole Keir Starmer thing as well. We're going to get in a room. We're going to get in a room. It's fair, and it is fair that the Junior Doctors Union, BMA, and the Health Secretary are not in a room together talking. So that is a problem. But the idea you're going to get in a room, it doesn't matter what it is, immigration, healthcare, you just get in a room. If you can get in a room and have a chat and have a talk, then you're going to resolve everything. I'm just not as convinced that actually what people want is going to change because it's a Labour government. Although, of course, we have 5 days before the general election on the 4th of July, we do have another BMA junior doctors strike. It's the last group of NHS workers holding out for their pay rise that they've demanded.
Which is daft, because nobody can make a decision during that time. So why are they doing it?
No, but it's supposed to be the NHS making that decision. But why are they doing it? For political reasons, clearly. Right, got 2 questions I'm asking today. One of them is about Keir Starmer's pledge to make wealth creation his government's main priority in Labour's manifesto unveiled today. I want to know simply, do you trust Labour? Tell us why. Give us a call, 0344 499 1000, text on 87222. You can tweet us or get in touch on X, whatever it is, at TalkTV. Calls are charged at the national rate. Text costs 1 standard network rate. Message going to get to call in just a couple of moments. But Philip, do you trust Labour on this?
Trust is a difficult one. I think there's an inevitability of Labour coming in. We're even hearing that from Tory party ministers. But they're not giving us the complete truth. And the excuse book will come out from day one. Yeah. And the first excuse, as I said before, will be, it's worse than we thought. And therefore, all of the pledges we made were based on what we thought, and therefore we're going to bin them. And we know that that's going to happen. Yeah, absolutely. Well, lots of messages coming in. John has said, when asked, do you trust Labour? I don't know. I don't really see it happening. I think it will drown in an ideological meat soup made up of good intentions that just don't align with reality. Brett says wealth creation for him and his friends, which will be created by the working class. Jackie says no, because you can't create wealth and growth with net zero policies. I think that might be the same Jackie who called in a little bit earlier. Brian says wealth creation. What does that mean? Tax the poor? We will own nothing and be happy. Phil says wealth creation equals the exact opposite. Tax hikes and more stealth taxes, and there will be
there will be stealth taxes, whichever government, whether Tories continue or Labour, because of these. They've all pledged no rise to income tax, national insurance, VAT or corporation tax rates.
Yeah.
But we know, and I just want to keep reminding you of this, the tax thresholds will mean, and the inflation, again, still in the system, it's not gone, prices are still going up. They're not going back to where they were 2 years ago. They're going to stay up.
So it means
that means we're going to
up?
pay more taxes, exactly. James says no, because they're habitual liars. Jock says yes, but only for illegal immigrants. Got to get that in.